Great question, Surya. I think uh, this is something that we've had a big change in our understanding in medical science over the last 20 years. When I started my education and I did my undergraduation in India, in Jipmer, Pondicherry, we were taught very limited amount of probably specifically pain related knowledge. It was covered as part of physiology, a little bit in anatomy, but we didn't have much coverage beyond that. And then when I did my post graduation in anesthesia, it was actually a post graduation in anesthesia, pain management, and critical care. Once again, it was restricted to understanding a little bit about pain pathways and how to block it or numb it using injections or medications. And that was the level of teaching that I had even as a postgraduate in anesthesia and pain management. And when I came to the UK here in 2003, and this is now coming close to 21 years now, it is something that I've realized we have had a massive change in how we understand and classify the kind of pains we are having. And that understanding is now matured into a much better knowledge of the mechanisms of pain. And so, broadly, right now, the best way to understand are to say that there are four kinds of possible divisions of pain. The one kind of pain which is most common, that is when you get an injury or when you have a surgery, when you have a heart attack, when you have a flare up of your rheumatoid arthritis or something like that, where your knees are swollen or something that way, that kind of pain is called nociceptive pain, meaning that pain signals, chemicals are released at the site where you've had the surgery or the injury, and that kind of chemicals will activate the nervous system. That kind of pain is called nociceptive pain. The second kind is called neuropathic pain. This is where the nervous system itself has had a injury of some kind or some damage of some kind. Either it is caused by an external agent like a surgery cutting a nerve, or it can be an internal agent like a disease condition like diabetes where you get neuropathy, or alcoholism where you can get neuropathy, or multiple sclerosis or Parkinsonism, or a stroke where you have a damage to the nervous system. That is called a neuropathic pain. The third condition or the third kind, which is the newest condition which only got named in 2020, is nociplastic pain. What that means is that this refers to the conditions where the nervous system is not damaged in itself. So it's not like neuropathic pain. You also don't have any evidence of inflammation or injury or surgery. So it's not nociceptive pain as well. But it is a condition where the nervous system itself can get sensitized internally due to a trigger from the immune system or a trigger from some other threat-based factors, and it can sensitize the system such that it sends more and more signals. So here it is the quality of the signals that are changed rather than the structure of the nervous system, and it is called nociplastic, meaning that it is plastic, it has got sensitized. It's a good thing and a not so good thing, because the not so good thing about it is it's only been understood properly in the last 5-10 years. So we still don't have the right kind of guaranteed techniques or drugs or surgeries or interventions to restore it. The good thing about it is because it is plastic, there is a level of reversibility. That means there are other techniques we can do to reverse this kind of pain. And the examples that are typical of nociplastic pain are conditions like many kinds of low back pain, neck pain, a condition called fibromyalgia, many kinds of chronic fatigue where there is pain. Nowadays, we have conditions like long COVID, which is after COVID, a lot of people are left, that can cause pain. Many kinds of pelvic pain that can be responsible, irritable bowel syndrome, migraine and headache. These are all kinds of situations where you have nociplastic pain. And the fourth kind of pain is where you can have combinations. People are not going to sit in one bucket. Everybody cannot have only nociplastic, only nociceptive, or not neuropathic. Often it is mixed. And the mixed category has people have chronic pain for longer. And by chronic pain, I mean anything that is 3 months or more. That is where it is called chronic pain. It can become a mixture of these kinds of pain. So broadly, that is the 4 kinds of pain that we understand right now.